Hey, I hope everybody is doing fantastic today. So hopefully we have a great video coming up for you. So I'm just going to run through a scenario because it's something that I see happen pretty frequently here. So let's say you're out having fun, you have a little accident, and you hurt your low back or your neck. You have some awesome prickly, tingly arm pain or leg pain show up on you. So, like any person that's trying to have good due diligence, you go into the doctor after a few days when it doesn't go away on its own, and they do some x-rays, and then they do an MRI, and you go back in and you get your MRI results, but here's the kicker: you don't have any bulged or herniated discs. Everything looks normal. What the heck is going on? Well, there's some really crazy stuff that can happen in our bodies, which is pretty cool. And this is also goes along with one of these things like, hey, I just slept wrong, but my arm's numb. That doesn't make sense. Or, hey, I slept wrong and now I have shooting pain going down my leg. It just doesn't make sense. There's always something that's going on to cause those symptoms. So what we're going to talk about is cicatricial scar tissue development. So that's when you have an old injury and you injure your ligaments. What they'll do is they'll actually have edema, swelling, sometimes hemorrhaging in the ligament itself. And then what happens after that whole process goes through is that the ligament goes through a process of fibrosis, and then you're left with basically scar tissue within a ligament, or fibrotic scar tissue within a ligament. So at this point, what we would say is, okay, we would run you through the testing that we do here, make sure that it's not a disc herniation, anything like that, x-rays if you need them. But the big game changer here for us is that we use the Insight CLA equipment, and what we would do is we would actually pick up irritated nerve roots, probably on the EMG and most definitely on the thermal scan, and also on the DTG comparison on the thermal scan, which is actually looking at blood flow, and the other part's looking at actual temperature of spinal nerves. So when we pick up a difference on those, that tells us there is a problem there. You may or may not be symptomatic. So with that, if you guys have that going on, like there's just sleeping funny's not enough to really cause you any sort of injury to that extent, but if you are having that go on, make sure you get a hold of us and get the proper tests done so we can get you back on the road to healing. Have a great day, P.L.L.C.